Doing Marriage Well for the week of July 20th, 2026. Studies about sex that could make sex better for you and your spouse. July 20th, Sexual Health Issues? Why you must advocate for yourself. My virtual pile of articles about sexual health has reached a tipping point, so I will do some of them this week. I want to start by helping you understand how doctors deal with sexuality, or don't deal with it. As I have mentioned in the past, most doctors receive virtually no training about sex. Beyond that, few will bring up the issue. If you need medical help for sexual issues, you will have to advocate for yourself, push a bit, and ask for referrals if you don't get what you need from your GP. There's a growing interest in treating sexual issues. Unfortunately, much of that is done by individuals who don't have as much training as they should. You have the full-on charlatans who sell supplements for every conceivable sexual malady. These folks just want your money. The real concern is that so-called supplements can contain dangerous things. Many over-the-counter sexual enhancement supplements contain sildenafil, which is the drug in Viagra. So it might help you with ED, but it might also interact with heart and blood pressure medications, possibly causing dangerously low blood pressure. Exact numbers are impossible, but thousands have ended up in the hospital from taking sexual supplements, and as guessed, hundreds have died. Then there is off-label prescribing. This is a valid thing that doctors do. Often it is based on good research that the FDA has not acted on yet. But it means there is less testing than with FDA-approved drug prescribing and no approved dosages, which makes it riskier. For example, there is a growing trend of prescribing testosterone for women. There is good science showing this can help menopausal women have increased sex drive. But it can also result in side effects that are permanent, including facial hair or an enlarged clitoris. Other countries, such as Australia, have tested and approved testosterone formulations for women, but these are not available in the U.S. at this time. There are places that specialize in providing off-label drugs for sexual health. Most of them are telehealth groups who never see patients in person. There is little or no screening for pre-existing conditions that could make a drug dangerous for an individual. Because of the way our medical system is set up in the U.S., your options are sometimes limited. Bypassing your primary care doctor may be the only way to get a drug, but it also puts you at a greater risk. If you do this, I suggest you let your doctor know what you are doing so they will know and can give you testing or monitoring you won't get from the places that are providing you the drug. This is Paul, and better sex is not worth dying for. July 21st, Needles and Your Sex Life, the ultimate guy's guide to ED and PE. So guys, let's talk about needles and your penis. I'll wait a second for you to get over the thought. There are several FDA-approved drugs that a man injects into his penis at home, give him an erection. They produce a very hard erection in 5 to 10 minutes, and the erection lasts for half an hour to an hour. Men who have used it say, it just works. Side effects are rare and mild. And there are reports of the return of spontaneous erections because of the drug. There are treatments for ED that are less invasive, but if those don't work for you or result in unacceptable side effects, injections are an option, and the needle is very narrow. An off-label injection for ED is Botox, injected by a doctor. This increases blood flow to the penis, which improves erections. In one study, 86% of men with mild ED were helped. For moderate and severe ED, the rates were 79% and 64%, respectively. It takes a couple of weeks to kick in, and then it works for 6 to 9 months. Botox has been shown to be safe with only mild side effects. This treatment results in getting erections normally. As a side effect, the treatment can result in a larger flaccid hang size, an outcome men did not complain about. Botox is also used to treat premature ejaculation. This is new, and studies have been small, but good results have been shown and safety established. Positive results last 3 to 6 months, with increased time tapering off gradually. Many men were able to last 3 times as long as normal, which beats most other PE treatments. I'd call this one interesting, but needing more study. Fine-tuning doses and the injection site could make it better or more reliable. Another off-label PE treatment is injecting hyaluronic acid into the glands, that's the head, of the penis. This has been shown to significantly increase how long a man can engage in intercourse before it climaxes. In one study, the average time for men went from 38 seconds to 5.5 minutes. This time gradually lessened, but was still 4 minutes after 12 months. Hyaluronic acid has been used in cosmetic surgery for decades and has well-established safety. The only issues were minor pain or irritation at the injection site, which cleared in time. Finding someone to do these procedures may take some real effort, and those that are off-label will not be covered by insurance. But if you struggle a good deal, it may be worth the effort. Do your own research and know what you are getting. And of course, I'm not a doctor and I'm not giving medical advice. This is Paul, and who knew a needle could help you do sex well? July 22nd, the best natural supplement. Regular sex keeps you healthy. There's a large body of evidence that says regular sex is good for us in many ways, and this seems especially true as we get older. Before we look at the findings, with links to the studies in the show notes, let's address how research like this actually works. The classic rule that correlation does not mean causation is always a consideration. Some of the studies dealt with that, some did not. Another issue is determining which is cause and which is effect. Healthier people are generally going to have more sex than those with health issues. Some of the studies controlled for that, some did not. But the findings of these studies are important even when we say healthier people have more sex. It means having less sex may well signal a problem that we should deal with. Some of the causes of ED are things that can kill a man. Going to get help with ED could save a man's life. Depression limits sex and increases deaths. Dealing with depression will lead to both more sex and a longer life. And an unhappy marriage hurts our sex life and our mental and physical health. Working for a better marriage will improve all of those. Some of the benefits found in these studies were seen no matter how one had an orgasm. But some were only found when couples had sex, and for some, the quality of the sex mattered. Here's a quick look at some of the health benefits ascribed to sex. Sex can make menopause easier. Women who engage in routine sexual activity experience less vulvar pain, dryness, and irritation during everyday life. Sex can ward off depression. Sex can delay heart problems. Sex was positively related to later risk of cardiovascular events for men. For women, this was only true if the sex was good sex, meaning they felt satisfied by it. Men who had sex at least twice a week were 50% less likely to die of heart disease during a study compared with men who only engaged in it once a month. Sex can keep you from getting sick. Having sex once or twice a week significantly increases immunoglobulin A, an antibody in the mucosal membranes that is considered a first-line defense against infection. Sex improves bladder control. Sexually active women were significantly more likely to have a strong pelvic floor compared with those who were not sexually active. This helps prevent incontinence. Sex at bedtime results in better sleep. Sex improves brain health. Studies have shown sex provides various cognitive benefits for older adults. And last but not least, regular sex can result in a longer life. Multiple studies have found a correlation between an active sex life and a longer life. If you could buy all those benefits in a supplement, everyone would want a bottle. All it costs you to have those benefits is making time and energy for regular sex and having a marriage that makes regular sex possible. This is Paul, and doing sex well is doing life well. July 23rd, 2026. Want better sex? Start putting your fantasies on paper. What if you could improve your sex life from the privacy of your home, spending less than an hour a week? A recent study suggests you can. There's a link in the show notes. A group of 30 heterosexual individuals were asked to write out a sexual fantasy at least twice a week for 4 weeks. A control group wrote about having a meal with friends. At the end of 4 weeks, those who had done the fantasies had some big improvements in their sexuality. They had a significant increase in sexual desire, an increase in sexual pleasure, and fewer cognitive distractions during sex, especially less worrying about performance. They had an increase in positive feelings about sex and a decrease in negative feelings. The fantasy group also experienced an increase in partner connectedness. None of this is surprising. Sex is mostly in our heads, and writing out a fantasy changes how we think about sex. If you want to give this a try, keep it private at first. If you want to share what you wrote later, that's fine. But worrying about what your spouse might think will interfere with the process. Do write, be it longhand or typed into a device. Other studies have shown what we commit to paper or screen is more powerful than what we think about. Obviously, you write about sex between you and your spouse. Exploring something you have never done but think about is fine, but writing only about things your spouse doesn't want to do is a bad plan. Eventually, sharing some of your fantasies could be a good thing for your sex life, if doing so feels comfortable and safe. It will teach your spouse how you see sex and what you long for sexually. It could be a way to start a discussion about something new you want to try. And sharing a fantasy could be good foreplay. This is Paul, and fantasies can help you do sex well. July 24th, 5 proven habits of couples who stay sexually satisfied. It's common for both passion and sexual satisfaction to decline as a couple spends more and more years together. But there are couples who don't follow this trend. What makes those couples different? A study of almost 40,000 people looked at that. The authors pointed out that sexual satisfaction is important for the health of a relationship and gave this as a motivation for the study. The couples in the study had been together at least 3 years. The majority, 83%, said they were sexually satisfied for the first 6 months they were together. But many did not feel that way years later. 55% of the women and 43% of the men were generally satisfied, while 27% of the women and 41% of the men were dissatisfied. Roughly a third of both the men and the women said their sex life was as passionate as it had been at the start. Sexual satisfaction and ongoing passion were highest for people who had sex most frequently. Those who received more oral sex had more consistent orgasms, experienced more variety of sexual acts, and had better sexual communication. Let's talk about these things that correlated with greater passion and sexual satisfaction. Frequency. There is an obvious chicken and egg issue here, but it's still a valid issue. A drop in frequency either signals an existing drop in satisfaction or warns that one is coming. Making yourself have sex usually isn't going to improve things, but don't ignore the change. Oral sex. This could be about the pleasure oral sex can give or how effective it can be as foreplay. It might also be an indication of how sexually free a couple feels. You can have a good sex life without oral sex, but if either of you is less satisfied with sex than you used to be, adding or increasing oral sex could result in an improvement. Consistent orgasms. This is mostly an issue for women, but a lack of orgasm would certainly make a man unsatisfied with sex. Some women honestly don't want to climax every time. Some women want to most or every time, but say it's okay, or fake orgasms out of fear or shyness or because they think it's their fault. If you need to orgasm more often, please speak up. Most men value their wife's orgasm as much or even more than their own orgasms, and I bet he would be happy to make sure it happens when you want it. Variety. It's not just the spice of life, it makes your sex life more satisfying. You don't have to get crazy or keep finding new things. Using more than one position will do. Unscheduled morning sex or making out on the couch also qualify. Communication. Being able to talk is the lifeblood of a marriage and of your sex life. Good sex requires being able to communicate what you enjoyed, what you want, and what you might like to try. You also need to feel safe talking about what is not working. You can make sex more satisfying and bring back passion. Which of the things I've mentioned would be a good starting place for you? This is Paul, and a satisfying, passionate sex life makes doing marriage well easier.